Israel would like to reiterate its full support to WHO's effort in leading the processes to strengthen the way countries and the world prepare for, prevent, detect, and respond to health emergencies. We deem it essential that national, regional, and global efforts are coordinated and coherent, providing an effective framework and tools for member states and the global community. We should ensure that the outcomes of our negotiations are feasible and appropriate to achieve their purpose, a safer future for all. We believe that it's states' responsibility to protect their people's health. However, only through a joint global effort will we be able to enhance the world's capacity to face current and future spread of diseases. We consider the WHO to be the principal body in leading these efforts. The COVID-19 pandemic, as well as other outbreaks in recent years, have highlighted the importance of international cooperation. The processes we have started together are beyond ambitious. Israel wants to avoid duplications and ensure that the INB and the IHR working group work synergetically and in coordination. Israel, together with Morocco, also coordinates the consultative process towards the high-level meeting on pandemic prevention, preparedness, and response that will take place in New York this September. We believe that this work will complement, fuel, and accelerate our work here in Geneva. We would also like to take the opportunity to call for future streamlining. The success of international mechanism is determined by their efficacy. We note our past experience with COVAX, in which our attempts to offer millions of COVID-19 vaccines were not utilized. We must also maintain an appropriate balance between ensuring adequate provisions of emergency tools and medicines during global health crises, while also protecting the rights of providers and suppliers. With lesson learned, we must ensure that we are strengthening the IHR and providing stronger foundations through the INB to improve preparedness, prevention, and response for future pandemics and health crises. Chair, I would like now to address to some of the active emergencies mentioned in the DG's report A7611, and to start by thanking the World Health Organization and its team on the ground for their vital work conducted under extremely challenging circumstances around the world. These emergencies have affected millions. Given their scale, complexity, and inherent operational challenges, they have required the highest level of organization-wide support. By noting the report today, Member States will ensure the continuation of WHO work in providing emergency support in cases like floods, earthquakes, and conflicts, and support states to build sustainable preparedness for health emergencies and expand their capabilities. Chair, Israel reiterates its deepest condolences to the people of Turkey and Syria following the devastating earthquakes earlier this year. Israel supports WHO's response to this emergency, and through Operation Olive Branch also responded resolutely and without delay, sending hundreds of personnel and establishing the field hospital in coordination with WHO and other humanitarian organizations, which treated hundreds of people and saved lives. Israel also expressed serious concerns over a continuing health emergency in Ukraine and refugee receiving and hosting countries, triggered by the Russian Federation's aggressions against Ukraine. The war continues to inflict devastating impact on Ukraine's health system and has severely restricted access to medicines, facilities, and health services for the Ukrainian population. It continues to be important for WHO and member states to support the Ministry of Health of Ukraine to restore disrupted services, assist displaced health workers, and replace destroyed infrastructure. Israel is working with Ukraine on long-term medical rehabilitation program, focusing on mental health and orthopedic injuries who require prosthetics and rehabilitation. Israel also conducted dozens of capacity building and trainings for health personnel. We will continue to do all that we can to assist the well-being and health of the Ukrainian people. I thank you, Chair.